Multiple sclerosis is another autoimmune disease that we're going to learn about today. It affects mostly women and it develops in around ages 20s to 30s and even up to 40s. However, there are men who have them too. Multiple sclerosis is an autoimmune disease that attacks the myelin sheath on top of the nerve. There is no cure for MS and we can only treat it with medications and symptom management. Let's take a look at our signs and symptoms. The patient may experience vision changes that includes double vision, blurry vision, or nystagmus. Nystagmus is when the eyes move very fast back and forth, and it's kind of uncontrolled muscle movement that they can't help. Weakness is going to be in almost every single patient who has MS. Weakness can also lead to paralysis. Intention tremors are when you try to go and do something with your hands. So you intentionally are going to pick up your coffee cup, and when you make that intentional muscle movement, it makes your hand tremor or shake. So it's not necessarily just hands, but an intentional tremor. So intentionally trying to move your muscles makes them tremor. Okay, ataxia is uncoordination of muscle movement. So just disorganized muscle movement, especially with walking or picking things up and holding things. Slurred speech and scanning speech is very common. Sometimes you'll see where they're speaking and they kind of stop and it's like they're trying to get the words out, but the words won't come out. I have another video up on YouTube that you can watch. It's really good, showing exactly what this looks like or sounds like on a patient who has MS. But they could also have dysphagia or difficulty swallowing. It affects all the muscles in the body. So it's a neuromuscular disease. So it's going to affect our muscles and depress them. Mood swings are common. Bowel and bladder incontinence and constipation. So we have a patient who has a lot of paresthesia and then moving to paralysis, so weakness going on paralysis, and then we have all the things that come with the weakness of the body and paralysis of the limbs and the body. Memory loss and impaired judgment is common. They do start to have plaques that, like when they go get their MRI done, they'll see plaques on the brain and the spine. Memory loss and impaired judgment, and they'll have a hard time concentrating. So those are some things that could lead to mood swings, I suppose. And if, especially if you're a young, independent person and now you're having all these symptoms, it could really wreak havoc on your emotional state. Tinnitus is ringing of the ears and vertigo. So they'll have these symptoms as well. So just to recap, vision changes, double vision, blurry vision, nystagmus. Then they'll have the muscle things. So they'll have weak muscles that can lead to paralysis. And then we have bowel and bladder issues from the paralysis, constipation from the immobility. We have difficulty with muscle coordination. So you may see them walk with a cane or a walker because they need the assistance because their muscles have ataxia and uncoordinated, so they need help with that area. They also have the ear things, the tinnitus and the ringing of the ears and vertigo, which makes them dizzy. Speech things, so slurred speech, scanning speech, difficulty speaking, difficulty swallowing, dysphagia. Then the memory things, memory loss, impaired judgment, and mood swings. Let's look at diagnostic tests. It's going to be a lumbar puncture, and your lumbar puncture is going to show abnormalities, so increased protein and increase in white blood cells in your lumbar puncture. And then they're also going to do an MRI also, and the MRI is going to show they're also going to do a CT scan. The CT scan is going to show plaque on the brain and the spine. Another major symptom that these patients will have is fatigue. Fatigue is going to be experienced by every single one, and here's some ways that we can help them reduce their fatigue. So if we tell them to take rest and frequent naps, we'll make them better, okay? It'll make them feel better. It helps conserve their energy. We want to keep their body temperature low, so we don't want them to get overheated. So air conditioned room or a room with a fan or a fan blowing right on them helps them conserve energy. It helps reduce their fatigue. So I once had a patient who had MS, and every time I went to their house, they were sitting in a chair, in a recliner, resting, and they had their fan on, and they always had air conditioning on them, and you could tell that it's difficult for them to regulate their temperature when they have paralysis. So this specific person did have some paralysis, like mild paralysis on the lower extremities, so those parts of the body were hard to get temperature regulate. So we want to conserve energy. We want to also do light activity because we don't want anyone to be completely bedbound, but they do need to take frequent naps and they do need to rest, but we also need to do some light activity as well. We want to prevent DVTs, bed sores, and all those things that come with bedbound patients. Now, we want to reduce the risk of injury. Remember, these patients have poor coordination with muscle movements. They're also dizzy and they have some memory loss. So this sets them up for falls. So we have to make sure as the nurse, we're going to prepare their environment to reduce fall risk. We're going to make a clear path to the bathroom. We're going to get them assistive devices, a cane or a walker. Think about those things. Good lighting, it's all about fall risk and fall prevention. We also want to get them hooked up with physical therapy and speech therapy. So they may need some thickened liquids if they're having difficulty with swallowing, and the speech therapy will help teach them how to use the breaths that they have and how to get over the shakiness of their voice, or the scanning speech, and how to speak more clear and easier. Medications. They're going to help treat the symptoms that the client has. We can give Imuron, which is an immunosuppressant. It will help decrease that autoimmune response that's going on in the body. We can also give prednisone. Prednisone is one of the most common treatments. It's given IV usually. And from what I've seen and experience is they'll have a huge dose, and I mean like 1,000 milligrams of prednisone given IV over a couple of days, and then they'll go 8 weeks without it, and then they'll have another big loading dose. So that is one of the newer treatments that are out that clients with MS are getting right now. And I remember whenever I first started giving this treatment, 1,000 milligrams IV prednisone, I was like, that's a really high dose. I mean, usually we give like 40 milligrams at a time, you know, once a day. So this was really a shock. So I had to do some research, and it's like, yeah, this is the newer recommended treatment for MS now is really high dose prednisolone, which is prednisone or Solu-Medrol. And I was really shocked. And they say that it helps keep them in remission. It helps them manage their symptoms, and it makes them do better. So do they have side effects from this? I'm sure they get some of the fluid retention that comes with taking high-dose steroids. I've seen some facial puffiness and some of that stuff. So think about the side effects of the corticosteroids when you're giving high-dose corticosteroids as well. Moving on, stool softeners, because we have constipation is usually a big problem. They may be on bowel and bladder training programs to help regulate that incontinence, and the fact that they have severe weakness there in that area and they don't have good muscle tone with their bladder and bowel, so they need help. Tegretol will help with the paresthesia, and antispasmodic type medications that will help with the tremors and the spastic discoordinated movements of the muscles. So for the main treatments that you're going to see these patients get that helps the MS itself is the immunosuppressants like Imuron, and then the high dose prednisone or corticosteroid that's going to help suppress that immune system so the patient can have a better quality of life and less symptomatic.